of further strain on the NHS after the biggest nurses' union, the RCN, voted for more strike action after rejecting the government's latest pay offer. And for the first time, some critical care services, such as intensive care, will not be staffed. Let's talk to Rachel Power, who's the Chief Executive of the Patients Association. Thank you very much for joining us, Rachel Power. That will strike fear amongst many people who are listening this morning, watching this morning. Critical care services, such as what, in terms of what will be affected?
Well, we're still waiting to find out exactly what's happening, but, you know, we heard this morning from Julian that it will affect emergency care, intensive care treatment, and this can be really worrying for patients out there who have already had a very tough time through the pandemic and through the last winter. And the Patient Association's focus is always on the patient and them receiving the best health and care outcomes that they can do.
In terms of what you do know at this moment in time, what should patients who are either on a waiting list or who have something booked already, what advice should they be taking now? What can you offer them in terms of assurance?
Right now, we've been assured that anyone who has an appointment needs to attend for that appointment unless they hear differently. So we would encourage patients to continue to attend. Our recent survey, though, showed that over 50% of the patients that we spoke to had appointments cancelled. And it's really important that there's really good, clear communication with patients so they understand what's happening, because the impact of waiting for treatment on patients is really difficult, with patients reporting the not being able to continue with their day-to-day lives and the impact that has on their mental health and loneliness and isolation.
How frustrating for you is this situation?
It is frustrating for all patients, and we really call on the government to show clear leadership now and the unions to get back around the table and stay there till they find a solution, because patients are having a really tough time, and we do appreciate that healthcare professionals have worked really hard during the pandemic, but every day patients are waiting for treatment.
Clear leadership by the government, what do you mean by that?
Well, I think we need the government to go back around the table, and we need to find a solution. We also need a workforce plan, and we've been waiting for the government to announce their workforce plan that really looks at recruitment, but also retention of the staff that we already have.
Well, do you think what is being asked for now would be the answer in terms of retainment and recruitment?
It's really hard for the Patient Association to get involved in the actual deals, because that's something we've spoken to patients about. So we really have to remain focused on patients and making sure that they're getting the best information about what's happening to their treatment.
Now, the Patients Association believes that patients should have access to safe and effective care when they need it.
Yes.
They're not going to get that, are they?
Well, you know, we heard Julian this morning. At the moment, we've had a concern about patient safety for a long time in the NHS over the winter, and we wrote to the Secretary of State in January asking him to really look at the crisis, what's happening in the NHS. You know, we've seen the long ambulance waits, we've seen the delays in discharging medically well people. So yes, we are concerned about patient safety.
What has been the impact of the strikes we've seen so far on waiting lists?
People are going to be waiting longer, and you know, that's not acceptable.
I could have predicted that before the strikes happened. What have you seen? What evidence do you have now?
We've heard from patients where their treatment has been cancelled. We've heard from patients where they haven't heard what's happening next. So definitely there is, and you know, it's waiting for preventative as well as curative treatment that's having that impact on their lives.
Rachel Power, Chief Executive of the Patients Association, thanks very much for your time.
Thank you.
9:30.